Right, welcome everybody. Sorry for a minute too late, but welcome to this ICP, and my third as chair, co-chair, so Councillor Martin will be taking over the next three. Yeah, welcome to those watching on YouTube. Hopefully there are some. I think there were 59 on the first meeting, which was excellent. Because of the elections, as you probably know, each board we seem to be going to, we've got some new faces. So again, I know it takes time, but and I know some of you have been at all of the meetings, but I do think we need to go through and just sort of introduce ourselves so we know who we are. So I'll start off with myself. I'm Carol Hart, and I'm Cabinet Member for Health and Communities at Derbyshire County Council, and I chair the Derbyshire Health and Wellbeing Board. So if we start over here, so thank you.
Good morning everyone, I'm Natalie Hoy, I'm the Cabinet Member for Adult Social Care from Derbyshire County Council.
Morning, I'm Ellie Holston, I'm Director of Public Health for Derbyshire County Council.
Julie Patton, I'm Cabinet Member at Derbyshire County Council for Children and Families.
Good morning everybody, I'm Stephen Bateman, Chief Exec for DHU Healthcare.
Good morning everyone, Mark Powell, I'm the Chief Exec at Derbyshire Healthcare NHS Foundation Trust.
Morning everybody, Katie Marshall, Chesterfield Borough Council, here in place of Christine Durrant.
Chris Pienaar, a representative for Derbyshire, for the VCSC sector and CEO Derbyshire Autism Service.
Morning everybody, Wyn Garnett, Programme Lead for engaging the voluntary community and social enterprise sector in the integrated care system.
Hello, I'm Jeff Sweeney. I'm the Director of the Multi-Faith Centre, and I'm here as a representative of the VCSC sector.
Hi, Andy Smith from Derby City Council, Strategic Director for People.
Hello, my name is Nasreen Iqbal. I've come in place with Health Watch Derby for James Moore, Chief Executive Officer.
Good morning everybody, I'm Chris Weiner, Chief Medical Officer at Derby and Derbyshire ICB.
Hi everybody, Craig Cook, I work for the ICB here representing Origin.
Good morning, I'm Vicky Wright, I'm Deputy Director of Strategy and Partnerships for East Midlands Ambulance Service. I'm here on behalf of Will Legg.
Morning everybody, I'm Tracy Allen, I'm Chief Executive Derbyshire Community Health Services.
Morning, Kate Brown, I'm Director of Joint Commission and Community Development for the ICB.
Good morning everybody, I'm Richard Wright, I'm the Interim Chair of the ICB.
Morning colleagues, Chris Clayton, Chief Exec of NHS Derby and Derbyshire, thank you.
Thank you. I'm Councillor Alison Martin. I've just become the Cabinet Member for Health and Adult Care here in Derby, and obviously now I'm the Chair of the Derby Health and Wellbeing Board and will chair this next meeting. I'd just like to thank everybody for coming to Derby. Welcome to the Council Chamber.
We have apologies, Councillor Hart, from Avia Patia, Carol Camis, Christine Durrant, Duncan Gooch, Hal Spencer, James Moore, who's covered by Nasreen Iqbal, Councillor Whitby, Kim Harper, Jeff Sweeney is covering, Simon Stevens, Sean Thornton, Stephen Posey, William Legg, Vicky Wright is covering, Zara Jones, Craig Cook is covering. And that's all.
We all know Robin.
Good morning, Robin Jewis. I'm Director of Public Health in Derby.
Thank you, Robin. Yeah, there's quite a lot missing then, but it's still not a bad turnout. So, yes, so we'll start on the agenda. So it does say late items, but there are no late items, so we can remove that one. Declarations of interest? No, no declarations of interest. So if we go on to the minutes of the previous meeting, for those that were in attendance, for accuracy or any matters arising on page 1, 2, 3, 4, 5, 6 and 7. I'm all happy to approve those, the people that were there. Thank you. Right, so we get on to the major items, and this is an overview and update of the Integrated Care Partnership, and I think that this is really going to be good because of the new members particularly, and you know, bring everybody up to date. So it's over to you, Andy. Thank you.
Thank you, Chair. So I'll start this one off. So the purpose of this paper is to provide just a brief overview of the Integrated Care Partnership for new members and for ICP members to consider how we take stock to ensure that as an ICP we've got the right focus moving forward over the short term. As an ICP, it's important we work together to harness and maximise the experience, expertise, relationships and resources that we all have in this space to improve population health, reduce health inequalities and improve the integrated delivery of health and care services. Just as a way of really brief background, colleagues will be aware that the integrated care system is made up of two formal governance structures, the integrated care boards and the integrated care partnership. ICB is broadly responsible for planning and delivery of health services and took on the joint commissioning functions from the previous CCGs and some from NHSE, and they've got the power to commission services in line with the forward plan. I think the forward plan's on the agenda later, which Chris will talk about. And then the ICP is a joint committee between the NHS ICB and upper tier local authorities in bringing together this alliance really of partners to facilitate that joint action to improve health and care outcomes for the whole population across Derby and Derbyshire. The main function of the ICP is to develop an integrated care strategy, and developing the strategy has been the main focus really of the ICP since it was formed. Initially we set up as a shadow ICP in February last year, and then formally we convened as an ICP in February this year. And Derby City Council hosts the ICP on behalf of the whole system. So the broad purpose of the strategy is how we all work together to improve the health of Derby and Derbyshire citizens and make those transformational changes we think are needed to tackle system-level health and care challenges. So the key areas of focus are outlined in 4.23 of the report. I'm not going to read them through, Chair, they are there. But there are three areas broadly around start well, stay well and age well and die well. And we've considered and signed off the ICP strategy at this meeting, and it was approved for publication just last month in June. So where are we now? So as you said, Chair, the ICP has got some new members. We've got a new chair, a new vice chair, and the strategy was agreed just last month. And it's time, I think, for us to have another look at our terms of reference. So this all presents a good opportunity for the ICP to reflect, take stock, consider its purpose, roles and approach moving forward, including how it relates and works with both health and wellbeing boards, whose roles remain largely unchanged. So there are some questions for reflection at paragraph 4.32, and it's recommended that we explore these questions in a development day for members of the ICP and the two health and wellbeing boards. The last day we had planned was postponed, which is back in June, so it's timely now really for us to think about setting something up. And we're planning, I think, to do that around the autumn. So subject to any further comments, I would ask the ICP to agree the recommendations and we go forward in setting up that development space. Thank you.
Thank you for that, Andy. I mean, I think one of the things that I pick up more than anything is on 4.2, effective working with the ICS requires much closer collaboration with NHS and local government. And I think that that has really gelled with COVID. I think we all found that we could work better together, and it certainly helped. And we also made much quicker decisions as well, which was great. And I think that the NHS realised that local government has a lot to, you know, to offer. Anybody would like to comment on that? Ellie.
Thank you, Chair. So just on the recommendation, I think there might be a typo where it says to agree to hold a facilitated joint development session between the ICB and the Health and Wellbeing Boards, which should be the ICP. But on that basis, my team previously, we did agree to facilitate and organise that. And it became really difficult because of the election, but we're very much supportive of that and we'd be happy to take on the facilitation of that development day again.
I think that would be really useful, yeah. We have been doing development sessions in other boards, and I think with the new members we need to bring everybody up to date, so I think that would be an excellent way of doing that. So any other comments? No? All right, we'll accept that on the recommendations then, and we'll start to move on that. That would be good. Thank you. Right, so we're now going to do the update on the integrated care strategy. So it's Kate. Thank you.
Thank you. Yes, as we just noted there, the strategy was approved through the ICP in April and then through the cabinets of both local authorities during June. So this is just a brief update, as we all recognise strategies are very long-term processes, but we wanted to update today on the work so far and also to flag some of the emerging challenges of delivery of the strategy for the partnership to consider. So as part of development of the strategy, during May, we held some engagement events for all of the 3 areas, so the Start Well, Stay Well and Age Well. Those were online events, and we do recognise the restrictions of online events in terms of access for everybody. So we're working really hard with engagement support to consider how each of those programmes engages with the public as we proceed with development of the particular strands of work. But the sessions that we did hold had over 350 people joined across the session, so gave us some really great information and ideas to feed into the development of the plans for the delivery of the strategy. Also in June, we'll be coming on to the Memorandum of Understanding with the voluntary sector as part of the launch of that memorandum in last month. The launch day had some opportunity for share and contribute sessions, which again were themed around the 3 areas, which again have given us some really valuable information about how we might shape the plans and implementation plans, which we're just about, we're working through what those sessions give us and the information that we need to build in. But each of the areas already has a planning structure mechanism with partners around the table, and they're developing their route map for delivery. And the first step was to have a bit of a stock take of whether they had got the governance, the structures and the processes and how they might start to develop that. So included in the paper today are some of the themes that are coming through there in terms of the envisaged challenges of delivery. Things such as the capacity to deliver the change management resource needed. We know we've got a lot of change management happening across the system and a lot of operational delivery that requires those skills. And so there is a concern about the ability to continue to direct and to ensure we prioritise time for the longer term strategic developments. There's, from some of the Stay Well work, recognising that prevention inequalities is everybody's business and the need to build that into strategies. So getting the balance between the specific work that the team will do, but also making sure that all organisations are supported to build that into their own planning and processes. We continue to think about how we make sure we have strong local community and voluntary sector input to the planning, and there are representatives around on those planning structures, but it's not just the work that happens in those structures, it's the work embedding the change of thinking and approach to move to a real asset and strength-based approach across our system, which again we'd encourage all partners to consider in terms of developing their own strategies and approaches. We're trying to think about how we use all the resources we've got, and there's lots of expertise across the system in terms of things like prevention, psychological insights, how we build quality conversations and develop all of our staff to think differently about how they engage with the population and how we can start to change the culture of how we work really collectively and in integrated ways around those shared ambitions. And so we're trying to make sure we're embedding that in terms of how we develop all of the approaches. I think we include that to emphasise the fact that this isn't about separate planning and delivery processes. It is about trying to embed that into how we work. And that's the same in terms of how we think about the data that we're using and how we make sure that we're, in all of our work, focusing on the opportunities around planning for populations, thinking about how we integrate, how we co-produce, and how also we ensure that our governance processes for decision making are aligned across the system to support delivery, as we are finding, and it was, as we developed the strategy, it was an emerging theme about sometimes navigating some of the decision-making processes can be challenging. So again, something that I think as an ICP we need to give attention to. Then some very specific things for each of the 3 areas. So for the Start Well, Stay Well, a request that people really prioritise those prevention approaches across their own all service pathways supporting early years and thinking about those opportunities there, using the insights that's being gathered that exists, and we've got a really brilliant platform now for insights gathered across the whole system that people can tap into and access when they're planning, redesigning services, planning longer term, to understand the needs of particular populations, and just to make sure that we're building that into how we develop the responses to the challenges that the strategy set out. as I've already mentioned, thinking about prevention and health inequalities, life expectancy, and how we turn those ambitions into real deliverable opportunities. And the Stay Well group will work really hard to translate those ambitions into particular asks for partners, so they will emerge as we develop that work. And finally, thinking about the Age Well, Die Well work, ensuring that we're planning and thinking in an integrated way. We're just on the point of receiving some diagnostic work done around community transformation opportunities that will give us some really significant opportunities, but also challenges in terms of how we plan and think together and how we balance that organisational delivery against overarching system ambitions, and all of this recognising that the pace at which new financial models, mechanisms for commissioning and operational delivery, the pace of delivery of the overall strategy will be affected, either accelerated or restricted by the opportunity and pace at which we can manage some of those complex changes. I mentioned at the start that we have had some public and stakeholder engagement already. We drew on that in terms of development of the strategy. We've tried to then share the strategy and seek views from the public and from voluntary sector as fantastic representatives of communities that they work closely with. But we'll continue to embed that approach and adapt and listen and iterate how we develop each of the strands of the strategy as we proceed. And although we've honed in on the 3 areas of the Start Well, Stay Well, Age Well, another theme for the whole strategy was about the importance of enablers, be that about culture and development, be that about structures and processes, be that about workforce planning, IT and estates. And again, I think we'll be bringing back to the committee how we're trying to influence and shape those enablers in response to the strategic ambitions that were signed off here. Thank you.
Thank you, Kate. Yeah, when you think that we've sort of all, we've got new relationships, and it's been working on that, and now we've sort of recently we've seemed to have had a bit of a hiccup with the elections and everything else. Hopefully now we've got a new chair of the ICB and we've got new councillors, and 4 years in this respect at Derby City. We've got elections in 2 years, but at least that gives us a lot of time to bed in and really start to work together. I think that's the most important thing. Any comments on that? Anybody like to? The request is, the ICP is requested to consider its role in response to the challenges and opportunities emerging from the work in the key areas of focus. Anybody got any comments? Oh, everybody's very over to you, Chris.
Yeah, thanks, Chair. I mean, massive thanks to members of this board and other stakeholders who've helped us pull it together. I suppose what I wanted to say is that the work starts now, doesn't it? So what you've just said about having some continuity around leadership is going to be really important. We've got the overarching strategy now, so there's significant work in the executive space for us to be bringing things for consideration to the partnership underneath those priorities. So huge thanks. Work starts here. Thank you.
I mean, I do think when we have the get together and start, some of these things will probably come out of that conversation. Certainly. Anybody else would like to comment? No. As I say, I think we make sure on the agenda when we have that meeting and think that we will sort of try and thrash some of these things out. It is difficult, and I mean, I know you're saying what, about 350 people have actually logged in and been involved. So I mean, there is an awful lot of interest, but I still think as things go on, there are things that crop up, and you think, oh, actually, we hadn't thought about that, and so there will be things and changing, and yeah. So if we note that, just before I go on, I was going to say as well on the previous item with Andy, it does say in the terms of reference that we won't take any late reports, and yet on our agenda it always starts off with late items to be introduced by the chair, so I think we ought to perhaps delete that from the agenda next time, just to prove I do read the terms of reference. So thank you for that, Kate.
That item does have to be on the agenda. That item does have to be on the agenda, just in case there's anything of great urgency that's happened that it's not been in time to get onto the agenda. So we do have to keep that
Yeah, I mean, I appreciate it that yeah, we've had queries about this, about how can you bring things forward late, but it does seem funny when it says in the terms of reference there will be no late items, and then, so perhaps change the wording on the terms of reference when we get round to that. But
Yes, thank you. Good morning, everybody. I'm going to take you through the something called the Memorandum of Understanding, which is a document that sets out how the VCSE sector might be embedded in the integrated care system. I see I've got about 20 minutes on the agenda, so I'm going to keep it quite tight. It's going to be quite a quick presentation. So if you do want any more information or you want to explore things, I'm hoping to leave a bit of time for questions. So please do use that if you want to do so. What I'm hoping to do is to take you through a bit of context about what the MOU is, the process we've been through to arrive at this, what's contained within the MOU, and what happens next with it. And what we're hoping to do with the ICP today is to get your approval to endorse this as an integrated care partnership board. So that's what we're hoping to do. You'll have had previously circulated with the papers a copy of the Memorandum of Understanding itself, so you'll have more detail relating to that. So just to provide a little bit of background, for those of you who are familiar with the Integrated Care System National Guidance, you'll be aware that there's a lot of detail in there around the importance of the voluntary community and social enterprise sector as a key partner in moving things forward. And I think the importance of that, it relates to some particular areas in the ICS guidance. So the role the VCSE sector plays in addressing health inequalities, in operating within the preventative space, in underpinning services that are already provided at present, developing new approaches, being very flexible in what it does, and engaging all sorts of communities, whether those are communities of place or communities of interest or community of condition. And I think in the recent past, we've seen lots of good examples of that. So, for example, during the pandemic, we saw some really good examples of how VCSE organisations of all sizes responded very quickly in that space to respond to the challenges that we faced. So this MOU is set in that context, the context of the VCSE sector being a key partner in the integrated care system. Now, I think there are challenges in building this relationship, and I think it's important to say here that over the last 2 or 3 years, we've made significant progress in this, and thanks to partners for the work they've done with us in helping us to move that forward. But there are challenges in trying to make this work, not least trying to relate 15,000 plus VCSE organisations into a formal structure with particular hierarchies to it. So trying to fit a sector that's very different, doesn't have particular control and command structures, that often disagrees within itself, trying to relate that to a very particular structure is not easy. I think there are issues about the level of mutual understanding we have with each other, the different cultures we have as organisations, the power imbalances, I think, between the sector and other partners. And I think some very specific things around our engagement in commissioning processes, issues around data sharing. And it's interesting in the sector at the moment, we know that there are real issues around recruitment and retention, and volunteering appears to have dropped off a cliff after the pandemic. So real issues around attracting volunteers to underpin organisations. So we face some real challenges. And in that context, the national guidance had 2 must-do expectations for the VCSE sector. The first was the establishment of something called a VCSE Alliance, which was to bring VCSE organisations together to act as an access point for the system and to relate to other partners. And the second was to, through that VCSE Alliance, to develop something called a Memorandum of Understanding. And that Memorandum of Understanding is to set out how the VCSE sector is embedded in the integrated care system as a partner. Everyone looks different in each system, so I've seen MOUs that are long documents and are legally binding. I've seen ones that are a couple of pages, so there's not necessarily a consistency from system to system. But the brief that we were tasked with when we set off doing this a year ago was that we wanted something that was short, sharp, measurable and practical. So we wanted something that we could use as a working document. And I'll leave it to your feedback as to whether we've achieved that or not, whether it is short, sharp, measurable and practical. Okay, if we'd like to move to the next slide. Okay, in terms of process, we're a little bit out of step with this particular ICP meeting, because this was to have come to the postponed meeting in June. So we're a little out of step with where we wanted to be. But in terms of the guidance, what the guidance was looking for was for the Memorandum of Understanding to be signed off by the Integrated Care Board and the Integrated Care Partnership. It was either or both, and I think in Derbyshire we felt it would add some real strength if we could get both the ICB and the ICP to sign this off. So in terms of process, this document has been iterative. It's been worked through a long process. It's been shared through a whole range of VCSE networks, forums and infrastructure. It's gone through pretty much every part of the integrated care system. It's gone to delivery boards, to the local place alliances, to the place partnerships. And it was discussed and approved by the VCSE Alliance itself. It then went to the ICB on the 15th of June. Really good discussion there and some really positive feedback. It was endorsed by the ICB on the 15th of June and was launched at the event that Kate mentioned, the VCSE system-wide event on the 26th of June. Brilliant event. I think we had around 220 people there, and we had to close the bookings, so it was a really well-attended event. Ideally, it would have come here on the 7th of June, but obviously that meeting was cancelled, so it's come slightly later here than was originally intended. If we could move on to the next slide, please. So in terms of some of the feedback we had through that, I won't go through this in huge detail, but some really good feedback in the discussions we had with colleagues from all sectors. I've picked 2 or 3 of the key ones out there. So one of the main bits of feedback was around the importance of involving the breadth of the sector at the outset in all of the planning cycle stages. So I think there was a bit of a sense that maybe in the past there's been more involvement in the sector as a provider than there has in some of the work around setting agendas, priorities and co-designing and co-producing. So the importance of engaging at all the different stages. Really interesting and really positive that partners felt that the statements in the document ought to be we statements rather than having statements from the sector and statements from other partners, which I thought was really powerful. There were things in there about how we might address some of the issues around power dynamics and importance around things like co-production. So we had a lot of feedback, as you'd expect. The feedback didn't always agree with each other, but we tried our best to accommodate everybody's thoughts and comments on it, and that's contained in the document you've now got in front of you. If we could move to the next slide, please. So difficult, smaller type, apologies for that on the overhead there, but this is just to give you a sense of what's contained in the document. So the MOU itself is divided into 3 or 4 areas. So we have a preamble which sets out the context, which is what I've just covered. We have a section on principles, cultures and behaviours about the way as partners we ought to behave from all sides if we're going to effectively involve the VCSE sector. We have a section on aspirations and actions, and then we have a section on outcomes and targets. So this particular one about principles, cultures and behaviours, we divided these into principles and cultures around working together and principles and cultures around working within the system. I don't think there's anything particularly surprising in here, but important that they reflect the feedback we had from all sorts of partners. So there are things in there around the importance of recognising respective strengths, around building on assets that we have within the system, about the importance of co-production, and the importance of building a sustainable VCSE sector to work with. So nothing I don't think there that would be very surprising to anybody. If we could move on to the next slide, please. The next slide again just takes more of the principles, cultures and behaviours around working within the system. This covers things like how we might engage the sector in a structure that we have within the integrated care system in a way that doesn't undermine diversity. So sometimes there's a temptation to squeeze the sector into a structure and losing the very strengths and positive things that the sector brings. So how we can manage to do that. How we can ensure that we involve the sector in all those different parts of the planning cycle, recognising the independence of the sector, and being prepared to take some risks sometimes. Because I think one of the things that came through the feedback was sometimes the sector is more risk-taking than some of the other partners, and how we accommodate some of those differences in culture. Next slide, please. So in terms of aspirations and actions, there could have been a number of these, but we focused on a smaller number to make this manageable. So we focused on some of the practical things that we think would make a difference to engagement in the sector and partnership working. So we look at things around intelligence and data, so the way in which the VCSE sector and organisations within it can help shape intelligence through the soft intelligence they gather through working with communities. How we effectively engage the sector, so how we have places on the structures, but how we find alternative ways of engaging the breadth of the sector in what we do. How we ensure that we're able to be engaged in the various strategy developments that are on the agendas today, and that's something that's working very well, I think, at present. How we look at issues around investment, so things around commissioning, procurement and commissioning approaches to make them accessible and usable to the VCSE sector. We're getting some quite interesting feedback at the moment that there's a bit of a gap between aspiration and reality, and that we have organisations actually withdrawing from and not engaging with commissioning opportunities at the moment, mainly for fiscal reasons. So what can we do around that? How we support the sector to do what it is best at doing, how we address some of those challenges around workforce as part of the One Workforce. And I mentioned things like the rapidly reducing number of volunteers and the difficulties in recruitment, and things around underpinning culture and behaviours. So those are the areas that we're looking to focus on as we move forward. Next slide, please. You won't be able to see these because they're very small on the screen there, but they're all contained in the Memorandum of Understanding. But there was some really strong feedback from all partners that we ought to have some way of taking stock of the Memorandum of Understanding. So we ought to have some outcomes contained within this. Now that's something that I think is relatively unique within Memorandum of Understandings across systems. But I think there was a real sense that in order to know whether this is working or whether we're making progress, we ought to have some way of being able to take stock of it. So we've got items in here like ensuring that strategies, plans and initiatives reflect VCSE engagement, that qualitative intelligence from community engagement is shaping some of the insight work that's happening, that we've evidence of local VCSE organisations engaged in the procurement and commissioning of services. So again, nothing radically surprising there, but things that would indicate that this relationship is working. Next slide, please. And finally, just thinking about where this goes. So I think there was a real strong feeling that what we didn't want to do was to put all this work in over a year, get the sign-up of all partners, and then for it just to go in a filing cabinet somewhere or sit on a shelf. We wanted something that was a live document that was going to work. And again, some really positive feedback from partners about how we might build that in. So there was a sense that each year we should have some sort of cross-sector annual review, just to take stock of how we were doing. And that would feed into the Integrated Place Executive and come to this partnership just as a progress report to say, how are we working? How's the MOU going? Are we achieving the aspirations we're trying to achieve? How's that relationship working? And I think there's a sense that the MOU should be intrinsic to the work and behaviours of all partners. So when people are thinking about developing pathways around service development, or when they're thinking about generating plans and developments, that this is something that's core to the thinking about how that happens and what's contained within it. So that's a very brief run through, Chair, of the Memorandum of Understanding. As I say, it's a little bit out of step with process-wise because of the last meeting was cancelled, but we're hoping that the partnership will endorse this. Thank you.
Right, thank you. And that was, yeah, very, very good. I mean, we've all got different sort of areas that, you know, they don't all gelled the same as everything, but I mean, some of the work that you've been doing, you know, and you just it seems to have expanded in that area over sort of the last 2 or 3 years, and where would we be without, you know, without that sector? And it's been approved by the ICB, so I'm just wondering what ICP members feel. Has anybody got any comments on it? Yes.
Thanks, Chair. As a provider across the whole of the Midlands, really, I just want to commend the work that Wyn and Chris and others are doing in the voluntary sector, because I don't see this in other areas. And I think it's to the credit of the ICB, the ICP, the councils and all partners across the system about how they've engaged fully with the likes of Wyn. But I don't underestimate the challenges that then therefore brings, because Wyn's highlighted that they came to the front in the times of COVID, but they're facing huge challenges now. I think it's up to all partners to try and get behind the voluntary sector and try and understand some of how we can support them, because if we don't, the ability to achieve what we want to achieve in terms of that integrated care strategy is going to be impacted hugely. So I would like to commend it, but I just we need to see how we can step up even further, support the voluntary sector in how they can support us to achieve the strategies and the actions that we're looking to put in place. But fantastic work in the last couple of years, as you mentioned, Chair, but I think we have our challenges ahead and we need to support what we put in place now going forward.
I always think back when we had Councillor Webb before Councillor Martin, and he was a real champion of your area. So Tracy, over to you.
Yeah, thanks, Chair. And building on what Stephen said, Wyn, I really commend this document, and more than the document, the process that's gone into its development. I think with the establishment of the Alliance, the quality of engagement from members of the sector in the ICS's work has just made an incredible step change. And one of the NHS colleagues, my understanding of the opportunities, benefits, but also the challenges that the sector faces has grown hugely. So I don't disagree, we've got a huge amount of work to do, but I am seeing much better engagement and some really tenacious, constructive challenge from colleagues alongside NHS and local authority partners in the planning work that we're doing through place, which will make a difference.
Thank you, Tracy. Yes.
Yeah, Chair, I'll back that up, because I've never seen this before to this extent anywhere else, so you've got to say really good. I think the challenges are fantastic, really, because, you know, supporting that sector over the longer term means we've got to work over the longer term rather than take short-term decisions and short-term changes. I think we're looking for continuity, but I think that's what this is all now about, isn't it? As we implement the strategy, it's taking those and staying with it. And I just think it comes out so strongly in this document, you know. So I thought it's a great job done, well done, but we've got to respond to it, of course.
Anybody else? No? Oh,
yeah, just to thank our colleagues here for the huge support, because I mean we've not seen this. I know I sound like a parrot on every time, but it is quite astounding to see the level of support that we've had and the close working together, which has allowed this all to happen. And seeing things like Derby Wellbeing, you know, reducing waiting lists on mental health, and community of practice for autism, seeing multiple partners working together and led by autism-led organisations. The children's partnership, seeing the launch of the Derby and Derbyshire children's hubs, neurodiverse children's hubs for neurodivergent individuals in their local areas. These are incredible advances. This is being made by working together. So thank you for that. And also thank you to Chris Clayton and John MacDonald, who carried the 2 keynote speeches at the VCSE launch and just demonstrated, you know, head on the commitment. So thank you for that.
Anybody else? No? But all the nodding and everything else has been said, so I presume that the ICP members are very happy to endorse this memorandum of understanding, and I can't see anybody shaking their head that way, so thank you. Yes, right, that was excellent, thank you. Right, So we're now going on to the Derby and Derbyshire NHS 5-year plan. So it's over to you, Chris.
Thank you, and thanks for Craig joining me as well. So if I can pull out probably 4 key points from the cover sheet and then hand over to Craig, if that's okay, Chair. So just to reiterate, this is the NHS's 5-year plan for Derby and Derbyshire. It isn't the ICB specifically. ICB is there to coordinate and pull together, but it is the broader NHS's 5-year plan. So that's thing 1 I'd like to pull out. Thing 2 is that it continues to iterate, although it's a 5-year plan. We review it annually in line with the requirements on the in-year position for the NHS. As we know, the NHS mandate obviously comes through the NHS through government, so we continue to review. The next actual review of this plan is in the autumn, so it shows that we're continuing to think, reflect and build it. But the third point I'd like to draw colleagues' attention to is, I think it's section 4.3 in the document, and what that does really brings together the conversation from earlier this morning around how the NHS's plan is formed. So you've got the 5-year plan of the NHS, the relationship with the integrated care strategy and the relationship and alignment with the Health and Wellbeing Board plans. And I think it really does set out the alignment we need to create, recognise we've always got more work to do. And then the last thing I'd like to just pull out before I hand over to Craig is in section 4.4, just the 5 guiding principles that we've used to think, as Chair says, more broadly and more long-term about what we want to see achieved, particularly in healthcare. So with your permission, I'll hand over to Craig, and obviously we'll take questions. Thank you, Chair. Thanks, Craig.
Thanks, Chris, and thanks, Chair. So, the purpose of this plan really is to set the NHS, as Chris said, on a different course to change the way the NHS operates. And to do this, we've been working with partners from across the NHS, but also the wider partnership on forming the right policies, really, to guide action, and they're outlined in the paper. I guess it is worth saying that this plan that was published on the 30th of June hasn't been done in isolation, so it's in response to some national imperatives from an NHS perspective, certainly the long-term plan, that's still relevant now as it's ever been, as well as the work that Kate talked about earlier around the integrated care strategy from a local perspective. I guess we've spent quite a bit of time analysing the challenges and the issues that have kind of got us to where we are, and that's then framed the action that we've proposed in the plan. And I've got a very short presentation just to guide colleagues through some of this work that we've done. So if we go to the next slide, thank you. So it's been quite difficult to reach some sort of consensus, I guess, in terms of what the key challenges are. So from the perspective of not only the NHS, but actually the wider health and wellbeing agenda, we know that the stock of good health of folks living in Derby and Derbyshire is reducing, and we know that it's unequal. So kind of forming this plan of action recognises we've got quite a gap to kind of close, right? The issue of demography is now, so the future is now on that point. So we know that in the next sort of 5, 10, 15 years, we're going to be having 10% more elderly folks within the community, and the intersection of that with multimorbidity is a real issue that we need to be preparing for, as well as responding to now. We spent a bit of time drawing on some of the work that obviously Kate did as part of the integrated care strategy about understanding the perspectives of the population and the public about what they want from their healthcare. And it's interesting, certainly post-pandemic, that more people want more control over the care that they receive, and that kind of gap between the extent to which they actually feel in control is probably widening. It is widening, and that's an issue that we have to grapple with. We all know about the supply side constraints that the NHS, but the wider public sector faces, workforce, estates and money, and the plan that we published on the 30th expresses and gives some real detail about the kind of the gaps that we need to be closing from that regard. But then, I guess from the perspective of one of real opportunity, particularly in the health sector, we know that technology is changing the way in which people engage with their health, but certainly changing the way in which healthcare is provided. And it's probably safe to say that there are going to be some major advancements in terms of diagnostics as well as individualised care through new technologies that the NHS has to respond to. And I guess from a local perspective, we can't really shape those things. Those things are kind of driven clearly nationally and globally, but actually we can prepare locally in terms of how we protect against some of the risks around that this new tech provides, but realise the opportunities. Next slide, please. Thank you. So I guess there are some key assumptions, and Chris said that, you know, this is a live document. This, you know, the next iteration of this, once we've actually got more detail about the action we're following in the autumn, but there are some sort of key propositions that we hold true in regards to the work that we've been doing. I guess the first one, and we're really wary about the over-medicalisation of the population health and equity agenda. We really do understand from an NHS perspective the role and the leverage that we have in improving population health. But I think it's really incumbent on the NHS working with both local authority, public health teams to really get the right balance in terms of what role the NHS has, certainly in the prevention agenda, and clearly the role of the wider public health offering. Kind of leads into the second point, really. So I think it's classically referred to as the 20% of health is actually healthcare contributes to about 20% of that overall health of a population. And so this plan is very, as Chris said, very much framed from the perspective about what the NHS can do and the new operating model that it has to get in order to maximise the 20%. And then that kind of leads to the third proposition, really, in that we know that the way in which we've been operating as a National Health Service in Derby and Derbyshire has to change. We feel as if we're not fully leveraging that collective power that we have, the expertise that we've got in different sectors, and that whole kind of connection piece to truly integrate by design provision is something that we're all committed to. So next slide, please. So I guess what's the document about? So in response really to the integrated care strategy, we've set out in clear terms our intention to change over the next 5 years. We're fully recognising the risks that this proposition holds. We know that we have to deal with the real proximal objectives around improving access and recovering from the pandemic, as well as creating the space and the time and giving people the resource to put these new models into play, working with the community and the voluntary sector, as Wyn was talking through. But actually, if you to kind of sum up the kind of new operating model that we're trying to design, it's preventative in nature, certainly more personalised for the citizen, intelligence-led, with services integrated by design. That's our ambition. That's kind of the future state that we are all aspiring to and deeming to put action to delivering. So I guess it's been quite difficult, though, to kind of understand, going back to the challenges, why we haven't been able to kind of realise this new, put into place this new operating model in the past. And we know that we've got to make new decisions, better decisions around the nature of the care that we deliver. We know we need to be changing our approach to and prioritising the type of workforce that we invest in and the skills, the new skills that we invest in, and actually the importance of financial resource and it as an incentive to change is something that we perhaps haven't really fully utilised in the past. And so kind of my take, or our take, in terms of pulling together this plan, certainly in response to the work that Tracy and Kate and the wider sort of IPE executive are doing. It's about that new organisation of professionals actually simplifying things and breaking down some of those organisational barriers that kind of get in the way. And actually a real test for whether the NHS is stepping up to this challenge is the extent to which we do create these new communities of professionals to solve problems and innovate and be flexible. So that's all good. I guess what's the next step then? So next slide, please. So these are the 5 guiding policies that I think Chris referenced to. So I'll just skirt over those, please, and just go to the next steps. Thank you. So there's quite a bit to do. So I think we've got sort of 2 guiding documents. We've got the integrated care strategy. We now got this joint forward plan. So what do we need to do? So over the next 6 months, and this is still going through a process of deliberation and discussion and hopefully agreement with partners from across the NHS. But we know that from a strategic perspective, we've got to be doing more work on specifying the detail of types of care and interventions we actually prioritise and deprioritise over the next 5 years. We're going to be doing some work to create a commissioning prioritisation framework to guide those decisions. We are going to be working with colleagues to define some smart objectives as to what success looks like over the next 5 years, and that will certainly flow through into the autumn update that Chris talked about. And alongside this, knowing the importance of financial resource, coming up with a new way of allocating money to flow across the NHS through a new resource allocation framework. So there's a lot of work there to do, but we know that it's an imperative. And I guess the kind of work that is being led through the IPE, involving the NHS, but involving the wider partnership, is that new operating model. And that's kind of where the real work is. So the kind of workforce development that's needed, the estates, the OD, is something that clearly is started. And I guess what we need to be doing from an NHS perspective is kind of speeding that up, really, given the challenges that we have. And that will hopefully then frame the operational planning process that we do every year. So a lot to do. Hoping that's been helpful for colleagues in terms of just giving a bit of detail about what we're trying to achieve. I'm happy to take any questions.
I would imagine there's been a lot of sleepless nights trying to produce a 5-year plan. It's a massive thing, and things are changing so quickly, aren't they, and with all the problems we've got at the moment. But one of the things that I do like is allocate greater resource to activities that will prevent, and it's on about prevention and localities. I know it's different at Derby City, but looking at the Derbyshire, we've got 8 districts and boroughs, and they've all got locality teams, and I think things have been working much better there, and they know the facts in their own areas. But prevention is what we're all about in local government, and always when we first set the Health and Wellbeing Boards up and we talked about prevention, the problem is that we haven't necessarily got all the money to be able to do all the preventative work, and the trouble is again that it takes a long time for the preventative work to actually kick in and save money. So there are problems, but Alison, you want to?
Thank you. I found that report really, I have read the plan previously, but I find your presentation of that report and your comments you're making very encouraging and quite exciting, and very much, as Councillor Hart said, I think councillors know that, we want certain things for our communities. Budgets will always be limited, but we know that health prevention, ill health prevention has to be the way forward. And I know that's been the ambition for a long time, but things really do have to change now, as you know, because I know the stats for Derby better, but obviously health inequality is getting worse. And it is a lot to do with lifestyle. We could have a debate about to what extent that's individual or socially, culturally derived lifestyles. But anyway, prevention is very much the key. So I very much support everything you're aiming to do there, and I think it's excellent. But I just, some of you know me, have the mixed fortune of knowing me previously as the scrutiny chair of this council. So just one little slightly critical observation, if I may say, is that so the language and the aims are superb, but I think you have to be very careful about how this comes across to members of the public, certainly, but also the staff. Because, for example, when you're talking about more personalised care, this is not currently, it depends what you mean by that, but this is not what people are experiencing because of all the problems there are with, they're not getting, you know, waiting lists, not being able to get through to the surgery. The problems that I don't need to listen to because I know you all know them. And so it doesn't mean that more personalised care shouldn't be an aim. It's just that I think also for staff as well, and many people here know NHS staff better than I do, it's very demoralising if you have a sort of management rhetoric that completely flies in the face of, is what you want to do, but it's what you can't deliver for people. And I think people, when that language doesn't fit the reality they know, that is also, it undermines people's morale a little. So, you know, just to say that it is excellent, but I think it needs to be, in the current climate, presented in a sort of nuanced and applicable, sort of a nuanced way. Thank you.
Did you want to come back, Chris?
Yeah, so fully agree with everything you said there. And that kind of context is really important to the next stage of works, isn't it? Where we actually do get into the detail of what we value as a health community, what we don't value, and then clearly that's going to be a process that's going to be very difficult to stand up, but it's imperative that we do it, and we will do it in a way with our staff, with citizens, as well as people working across the NHS, so it's done in an open and evidence-based way. So, and hopefully that will be the sort of process where that gap between perhaps the rhetoric and reality can be really explored.
If I may just add a little bit further. So, just to reiterate, this is the NHS's plan. The NHS predominantly delivers healthcare. You'll see in the next item the natural reality of the NHS being overcommitted in terms of use of its resources in delivering that healthcare. But I think it's really important that we signal the wish, the intent, as you say, Councillor Hart, to work in partnership on prevention and broader areas of overall health outcome improvement. And so I'll bring us back to the importance of the Integrated Care Partnership and its priorities, and the Health and Wellbeing Board and its priorities, and all of us working on those together. But really helpful advice and guidance. Thank you.
Anyone else? Yes.
Thank you, Chair. It's just a point of clarity, really, because I've discussed this on a number of forums, including the Integrated Place Executive and the Provider Collaborative Leadership Board. What I think is missing out of this, though, is the die well. You've got the start well, stay well, and age well as part of the ambitions of the Integrated Place Executive. Oh, sorry, the Integrated Care Partnership. You know, on the chart on 4.3, Craig, it's not got the die well. Are we saying that's part of the age well? But I think it needs to be specific in itself. Thank you, Chair.
Any other comments? No? Oh, sorry, Robin. Nudge me.
Thank you. And just really a comment that you raised around the NHS and its contribution to the 20% of health and wellbeing. And I just don't want NHS colleagues to forget the importance of the trusted voice of the NHS. So there's a lot that the NHS can do in messages they share and within those conversations that they have with people. But the other thing as well is also as an employer, so is huge numbers of people employed. So although in delivering care there's an amount that can be done, there's actually a much greater reach of the NHS as organisations. Just wanted to highlight that.
Yeah, I recognise that as much, Robin, as well. So that's why we've taken that long. We've used the ICP strategy as our guiding document ready to produce this. And it'll really work if it runs alongside 5-year plans by the local authorities as well. I mean, that's where we need to get to, isn't it? To find, we've got those parallel 5-year commitments by all the partners. We can actually assess whether they are delivering that ICP strategy as a totality. And that's how it'll work, really, at the end of the day, when we get into the delivery part of all of this, which is sensing and listening to the comments all through this meeting. It's about moving past that strategy and into delivery now, isn't it?
See anybody else wanting to speak? So I mean, we're being asked for comments. We've had a few comments back. I'm sure if anybody, I always say, if ever you think of something when you've left this meeting, you know, I'm sure that you can make contact and pass on, and we'll get the updated version, which is in autumn 23. So, yeah, thank you for that. Thank you. So we're going on to some items just for information. So the first one is a report from the Integrated Care Board. That's over to you then, Chris. Thank you.
Yeah, very, very quickly, Chair, just to highlight. So this is the formal reporting to the ICP of the activities of the ICB. It shows you, you know, what can happen in a quarter's time, given the scale of change that's on this report. So. Colleagues, I just want to raise under item 4.2, like all public sector services at the moment, the scale of financial challenge, and it's the size of the efficiency for Derby and Derbyshire NHS, 136 million for this year, and Table 1 just outlines the progress being made as we approach the end of quarter 1. I want to pull out the NHS workforce plan that was released nationally a week or so ago, and the important aspirations there in terms of increasing overall doctor, nurse and allied health professional numbers, which I'm sure we all welcome. Clearly, we're all supportive of the commitment made by government in terms of training, and we will bring updates to the ICP board in due course on our approach to the workforce plan. And then again, as Councillor Martin said, referencing access, you'll see under item 4.4, the GP Access Recovery Plan that was again launched nationally, and of course we'll be setting out our views on that in due course, and as part of the work in place, primary care networks, colleagues around the room I'm sure will see that in action, particularly as we go through the next winter. And then I suppose just to finalise, as part of the national NHS infrastructure, the Integrated Care Boards are subject to annual reviews and annual assessments, and 4.5 sets out those processes that we'll be going through in due course. And of course, Chair, you've already mentioned the change in chair arrangements, and Richard's here as a testament to that. I'll pause there, Chair, and take any questions. Thank you.
Yes, getting used to all the new people, but at least now, you know, hopefully we can move forward now with not too many changes. So any questions on the report from Chris? No, thank you for that, Chris. And so report on the Integrated Place Executive. That's you, Tracy. Thank you.
Thanks very much, Chair. Just pull out a few things and then happy to take any questions. So hopefully you can see this report dovetails by design as opposed to accident with Kate's earlier update on the integrated care strategy. And as her report said, the IPE is taking the overview of supporting and coordinating the implementation of that. So we've been looking at that. And then you'll see that the main focus of this meeting was on the Age Well, Die Well strand, which again, as previously reported, the IPE is responsible for that community transformation programme, making good progress around Team Up and the focus within that on discharge. And again, just linked to the 5-year forward plan and that focus on developing integrated teams around communities, it's worth highlighting that just across the way on this floor of this building, we've got a fantastic integrated team for Derby City with community health, community adult care and primary care all working in a co-located way, and they are driving some really fantastic improvements for older citizens in Derby in terms of reducing the need to get admitted to hospital and supporting people to get out of hospital more quickly and regain their independence. And then again, linked to Kate's report, you'll see that the IP is taking a particular focus in the coming months around these enabling functions. If we've got a shared purpose, we've got fantastic colleagues, clinicians and professionals with that shared vision of how they can work together. What we're finding is what's getting in the way is us and our organisational grooves and processes that we use to manage things like the places we work, the equipment we work on, the systems we use. So the IP is going to be really trying to drive through some of those barriers to make it easier for our colleagues to deliver the care that they want to deliver and support citizens across Derby and Derbyshire. The final thing I'll highlight is the work on community insights. Again, both the integrated care strategy from this partnership and the 5-year forward plan have benefited from a great deal of insight from citizens across Derby and Derbyshire about what they need, what they expect and want from their integrated care system. But we still have got work to do to develop that and make sure that as we continue to deliver, review and develop services to deliver the strategy, that we are constantly using the enormous amount of insight that actually all partners, BCSE, NHS, local authority, are gathering from communities at a really granular level. That's geographical communities and communities of interest, making sure that we can demonstrate that they are really driving decision making. Thanks very much.
Thank you, Tracy. Any questions for Tracy? Nope. Thank you. So we've gone to last time reports from the Health and Wellbeing Board. So Ellie, you're first. Thank you.
Thank you, Chair. So very short update from the Health and Wellbeing Board. We're currently in the process of refreshing and renewing our strategy. So we've got strategy development sessions running at the moment. Although the recent elections didn't impact on the chair on the running of the board, we have had some changes to membership. So we're working through those at the moment and inducting new members onto the board.
Yeah, it was a real challenge with the districts and boroughs all changing. So yeah, it's been a bit of a nightmare, but we're getting there. Yeah, we're just trying to encourage people to attend. It's and the trouble is when people were sort of getting used to taking over new responsibilities in the districts and boroughs, it sort of held some of them back. But hopefully we're getting to. We've got quite a lot of one-on-one situations to bring people up to date on our Health and Wellbeing Board. So yeah. Andy, are you doing the Derby? Thank you.
Thanks, Chair. Not much to say because, like the county, there hasn't been a meeting of the Health and Wellbeing Board since our last ICP, but the Derby Health and Wellbeing Board is in the process of updating our joint local health and wellbeing strategy, and we've got some development time coming up with the Derby Place Partnership and Derby Health and Equalities Partnership. Actually, I think they've already taken place in June, actually. So we've had some development time, and no doubt that will be coming to our next meeting of the Health and Wellbeing Board, which I think is next week, actually. And Councillor Martin now picks up the chair.
Any questions for Andy? No. Oh, yes, Julie.
I had a question previously. I don't think you saw my hand though, Chair. The Derbyshire Health and Wellbeing Board, could I ask perhaps as an agenda item for next meeting that we have a discussion regarding corporate parenting and prescription charges for care experienced young people? That would also give us the opportunity to speak to our colleagues at Derby City as well. Thank you, Chair.
Yeah, I'm sure that our Chair's meeting will discuss that because I have done my 3 in a row. So I'll be passing over to Councillor Martin, but we do have a Chair's meeting, discuss agendas, so we'll take that on board. So with that, I call the meeting to a close. Thank you very much for your attendance and everybody have a good summer, as long as the rain stops off. Thank you.